I'm going to come into my office. I'm going to get orders that I need to give a patient, Charles Kamang, his Brazilian penicillin medication. So I'm going to come over to my med cart here. I'm going to wash my hands. And I'm going to gather my supplies with my MAR that has his orders. So I'm going to grab a set of gloves. I'm going to put this onto my plate that I need. I'm also going to grab an alcohol wipe for my patient. I'm going to grab an alcohol wipe for my medication. And I'm going to grab gauze for my patient as well. I'm also going to grab a biohazard bin, which should be in his room. Okay, so I'm going to come over to my medication cart with my MAR, and I notice that I'm going to need to take Bacillin, 2.4 million units. So I'm going to come to my drawer, unlock my medication drawer, open up the drawer, and my first check, I'm going to see that the Bacillin is in the drawer. It says Bacillin 2 million units per ml, and it's going to be for my patient, Charles Kamang. Charles Kamang, date of birth is 11XXX, date of birth 11XXX. It's going to be taking 2.4 million units. 2 million units, I'm going to have to do some math. It's going to be taking it intramuscularly, and it's going to be taking it in his ventral gluteal site on his right leg, intramuscular. Weekly for 6 months. And the reason why he's taking it is for infection. So I'm going to take the medication out of the drawer, and I'm going to do some math. So I'm going to do my math out, then I'm going to verify it with another nurse, and it looks like I'm going to need to take up 1.2 milliliters of the Bacillin. So I'm going to take my alcohol wipe, clean off the top of the vial, let it dry. At that point, I can grab my syringe, which my syringe is going to be a 3 ml syringe, 23 gauge, 1-inch needle. Going to safely take off the safety device on the top, and going to draw back 1.2 mLs of air, then going to inject the air into the vial, and pull back 1.2 mLs of medication. Get rid of any air bubbles in my syringe. Remove the vial, and then put the safety lock up so that I can transfer it to my patient's room. I can put the syringe with the medication onto my plate here for transfer. Before I put back my medication, I want to document the manufacturer, the lot number. I want to also note the expiration date, which is 2020, and I want to do another check. So I want to say that this is going to be for Charles Kamang. Charles Kamang, date of birth is 11XXX, 11XXX. It's going to be, medication is Bacillin, and dose is going to be 1.2 mLs, which is 2.4 millunits. which we have here, the 2 million, but I did the math out. He's going to be getting it intramuscularly, and he's getting it for infection. At that point, I can put my medication back into my drawer, lock my drawer, and then take my supplies to my patient. So I'll take my plate, come to my patient's room, knock knock, shut the door for privacy. Hi Charles, my name's Justin, I'm a student nurse from HEC. I'm here today to give you your Bacillin injection. I'm going to be giving it to you intramuscularly in your right leg. I'm going to just observe quick for any signs of infection, if he's got any on his leg or wherever the infection was supposed to be, like checking his fever, temperature. Any signs of rash or discomfort. Ask him if he's feeling any signs and symptoms of infection. At that point, I'll put my MAR down for a second. I'm going to just ask him, Charles, what is your full name? He says Charles Kamang. What is your date of birth? 11XXX. I'm going to do my second identifier. I'm going to look at his ID badge or tag, Charles Kamang, 11XXX. So I've got my patient. Earlier, before I came into the room, he was assisted into this sideline position so that I'd be able to do the IM injection easier. Now I'm going to wash my hands. And just explain again that I'm going to give him this injection intramuscularly for infection, and he gets this every week for the next 6 months. Okay, gonna raise up the bed, make sure that he's safe in the bed, and then only expose the portion of his body that's going to be getting the injection. Okay. So like I said, this is going to be in his ventral gluteal site. So to obtain that, I need to be able to find out where his greater trochanter is. So I will end up putting my palm located on his greater trochanter. I will put my fingers up towards his iliac crest. And then I will also fan out my fingers towards his pubic area. And the spot that lands between my
index and middle
and ring finger is going to be my site that I will give the injection. Don't fall. So this is going to be my site, so I'm going to give a quick wipe with my alcohol swab, find my site again, and I will leave the alcohol swab here, pointing towards where I need to give my site injection. And for the purposes of this video, we're going to use this as my injection site. Okay, so that's all cleaned off, wiped off. I'm going to place the gauze between my 4th and 5th finger. Expose my needle. Because it's intramuscular, it's going to go at a 90-degree angle, and it's going to be bevel up. So squeeze my site. 1, 2, 3. I'm going to hold with my non-dominant hand the syringe, going to aspirate because this is a medication and not a vaccine, so there's no blood, and I'm going to inject the site slowly because this is a thicker medication. Take out the needle. Put the safety on. Then apply the gauze. And I'm going to apply pressure. No hand passing. I'm going to apply pressure and also ask the patient if he would like a cold or warm compress for any pain relief, any discomfort, and I will also tell him that I'm going to come back in to reevaluate his site, make sure that there's no signs of infection, no signs of symptoms, no redness, no discomfort. I'll also put him back into a position of comfort, raise the bed rails, lower him back down to his lowest position, and I'll take off my gloves, throw them away, wash my hands. I'll then exit the room and I'll document that I gave him the injection at 1 o'clock, and that I will go back, check him again, make sure that we got the right response, come back, and then document again.